Do you have a loved one in a nursing home during this coronavirus crisis? I do. I want to talk to you about 6 questions that AARP says that we should be asking the nursing home administration and staff. Hi, I'm Tracey Hawkins. I'm also known as Tracey the Safety Lady. I'm a national safety expert. I get to teach people how to live and how to work in a safe manner. Today I want to share those 6 questions with you so that you can make sure your loved one is being taken care of. Let's get started. Number 1, has anyone in the nursing home tested positive for COVID-19? That means staff members, that means vendors, and that means residents. Number 2, what is the nursing home doing to prevent infection? Do they have a process in place when staff members come and go, leave the building and re-enter the building? What about those residents who don't have private rooms? Number 3, does the nursing staff have the proper PPE? Do they have the gloves, the mask, the gowns, the face shields? Do they have what they need in order to keep themselves safe as well as to protect the residents? Do the residents who need that equipment, do they have it as well? More importantly, do they have the training in how to use that equipment in a safe manner? If not, when will they? What is the nursing home doing to facilitate communication between loved ones and residents? Some have the Skype or the Zoom or live streaming calls available. Ask your nursing home if they haven't told you. They have a person and they would have to schedule that, get your family together and everybody jump on the call, show your loved ones that you're still thinking about them and that you are there for them. I have a situation where my loved one has a hospice team. I'm already in the habit of having the hospice team check in with me with every visit. Whenever they're allowed to actually go, I ask for a picture or a short video. I also ask for vitals and any reports, any changes, anything going on, I need to know. I had that process in place even before this occurred. So make sure you know that you have a right to ask that even of the nursing home staff. Also, number 5, do they have a way to communicate what's going on, any news, any information with you? My nursing home has a social worker who makes the phone calls. He goes down the list and he's calling, letting us know what's going on. Also, the staff member who takes the time to call to let us know of any policy changes, anything that we need to know about. Today, I got my very first letter and I am so excited. It came from the nursing home. You can see how detailed the letter is. The most important thing about the letter is that they are letting us know there are no viruses. No one in the nursing home has been affected. They are doing what they're supposed to do to keep my loved ones safe. Some of the information included in the letter is also the guidelines that they're following. I can jump on the internet and I can follow along too. They're following the guidelines for the Centers for Disease Control, the CDC, Centers for Medicare and Medicaid, as well as the Department of Health and Senior Services. That's good to know. They're also talking about what's going on, any violations of the rules. For example, passing the items through the window. That's a no-no. And then finally, the question that they said that the administrator says they get asked the most is, when will this be over? They don't have any ideas. They're obviously following the rules. They're waiting for the specialists, the experts to tell them when it's safe for it to be over. I'm the person who was in the nursing home on a regular basis. I got a chance to know the staff and the residents as well as the families. So you can imagine how hard this is not being able to be there to see my loved one in person. But I understand that the shutdown is in place, or we call it the lockdown, that is in place for a reason, to keep my loved ones safe. So as long as they can continue to communicate, I'm okay. I can deal with this. Number 6, is the nursing home fully staffed? Do they have the nurses, the CNAs? Do they have all of the staff members, the dietary workers, the maintenance workers? Are they fully staffed so that our loved ones can get the care they deserve? That means medication, that means getting dressed, that means getting fed, social engagement. Is everything still happening? Are they staffed? And if the answer is no, when will they be? And what is their plan for getting it done? We have a right to know. We have a right to ask. Do not hesitate to ask. Also, keep doing your homework. For example, visiting the CDC website, that's where I found out if there's ever a positive case of coronavirus in the nursing home, they are required to notify us. Know your rights. Know what the guidelines are and what the rules are. Follow the rules. Keep your loved ones safe, and this will be over one day. We will be able to see our loved ones face to face, but until then, let's respect the rules and the guidelines that are in place. This is Tracey, the Safety Lady. Until next time, thank you so much, and be safe.